Hi, my name's Pip. I'm one of the physios at Sydney Advanced Physiotherapy in Linfield. Some of the most common questions we get asked about postnatal checks are, what is a postnatal check and when can I have one? A postnatal check is a 1-hour appointment with one of our expert women's health physiotherapists, and in that appointment we aim to check your head to toe alignment, and we also aim to do an abdominal screen. An abdominal screen involves us checking your abdominal separation. We check it for depth. We also use an ultrasound to have a look at your core muscles to see that you are able to contract them and that you're able to get a nice symmetrical contraction. In a postnatal check, we're also doing a pelvic floor exam. Now, this might sound like a lot to do in a 1-hour appointment, and it is. We don't always get through everything in a 1-hour appointment, but we do always endeavor to do so. Everybody's pregnancy and delivery was different, and that can affect how long each part of the assessment takes. It's important to understand that a postnatal check at Sydney Advanced Physiotherapy is a much more detailed assessment than the 6-week check you have with your obstetrician, gynecologist, or GP. Your alignment is important because it can affect your ability to turn on your core and your pelvic floor. It can impact whether you have a mummy tummy, which is a little bubble belly that you can't get rid of no matter how many sit-ups you do or how much weight you lose. Your alignment can impact the pressures within your body, which can affect prolapses and incontinence. It can also affect your ability to move, your ability to recruit certain muscles, and your ability to return to a sport of your choice. A thorough abdominal check is really important, and it's important because we need to check that the linear alba, which is the tissue that divides your six-pack muscle, is able to generate tension. So for example, when you do a crunch, or a little mini sit-up, it needs to feel like a t-shirt pulled tight, and often we find that it feels quite saggy and low tone. If you can't generate good tension in this area, then it can really impact the health of your lower back, and it can mean that you don't transfer forces well through your midsection, which leads to overloading of other joints and areas. If you can't generate good tension through this area, what we tend to find is that you don't transfer forces well through your midsection of your body, and this can really have a negative impact on your lower back. A thorough abdominal screen is also important because we need to use an ultrasound to check your lower, middle, and upper transversus abdominis muscle fibers, and that's your core muscle. We need to check that you're able to activate it well and that you're able to get a symmetrical contraction. This is really important because it's really common that we actually see imbalances in these muscles. So we can see an imbalance between left and right. We can see an imbalance between the upper and the lower fibers. And what this means is that it tends to relate to the area in which you will develop pain or issues if it goes unchecked. We find that the middle section, so around your belly button, is a common area of dysfunction. Then we tend to see lower back issues. If you have trouble turning on the lower sections of your transverse abdominis, so your core muscle, what we tend to see is that people have difficulty controlling their pelvis, and they can struggle with ongoing pelvic pain, which then affects their ability to return to sports and to do things like running. An abdominal check is also really important because sometimes there can be a risk of hernia. The way you turn on your stomach muscles can also impact your continence mechanism. And there's also the aesthetic side of things where people want their stomach to go back to looking how it did before they delivered. And to do that, we need to make sure that the right muscles are turning on in the right order. In regards to a pelvic floor examination, not everybody wants to have an internal assessment, and that's totally fine. We can assess it to some degree externally, and we can also, if you would prefer, just use the ultrasound on your stomach. And then that way we get a very basic understanding of your pelvic floor, but everybody is comfortable with different things. When we do an internal pelvic floor exam, what we're checking for is the function of each muscle. We're looking at its ability to contract and relax, how well it contributes to the contraction, and we're also looking at your strength and endurance. We're checking any scar tissue that may have occurred as a result of tearing or episiotomies. During a pelvic floor exam, we also do a thorough prolapse check. It is really important to have a pelvic floor check even if you've had a cesarean delivery. The strain of the pregnancy alone on your pelvic floor can lead to some changes. If you've had a cesarean, the physio will also ask to check your cesarean scar. The reason we do this is because there are certain techniques which we can do to help minimize scar tissue, which is wonderful also from an aesthetic point of view, but really important from a function point of view. Restrictions through cesarean scars can actually lead to issues down the track, which people aren't always aware of, such as bladder irritation, itching around the anus, and it can even lead to some nerve nerve irritation, which can, for example, cause knee pain. So it's really important to see a physio after you've had a cesarean so that they can help you with the scar, but also so that they can use an ultrasound to help you retrain those muscles in that area. So as I said before, it is a lot to try and get through in an hour, and we do endeavor to do so, but it's not always possible to get that all done in a 1 hour appointment. To answer the second question we often get, which is when can I come in for a postnatal check? The answer is quite simple. You can come in whenever you're ready. So we can do a lot of the alignment and abdominal work really early on, and we can get you started on scar management really early on. Generally with pelvic floor exams, we wait until your bleeding has stopped and all stitches are out. So usually that's around the 6-week mark when we start to see people coming in. But as I said, we can start earlier. We do often also see women 2, 3, 4 years down the track for a postnatal check. And it's important to understand that it's never too late. That being said, the earlier we intervene, the earlier we can have you feeling back to your normal self. The longer you put up with these issues, the more likely they are to have a negative effect. And as I said earlier, if you can't generate good tension on the linear alba, which often happens because people don't do a good core contraction or because their alignment is not right, then that can really have a negative effect on your disc's health. It's really common that we see disc bulges in the lower back as a result of poor control in that region. And it's really important for your lower back that you have a decent core system to actually support it. But again, I'd like to emphasize that it's never too late to come in and see one of our physios to get help for any postnatal issues. Pregnancy is a huge endurance event and a huge physical challenge for your body, and delivery is also another enormous challenge for your body to go through. I would strongly encourage you, if you are pregnant, if you've just delivered, if you delivered your kids some years ago, to make an appointment with one of our women's health physiotherapists. It's really important to have the support of a great women's health therapist who can help you better understand your body and take steps towards feeling better and preventing long-term health issues. If you have any other questions about what's involved with a postnatal check or any of our other services, please don't hesitate to get in touch with us. You can call us on 9416-4410, or you can get in touch with us via our website, which is sydneyadvancedphysio.com.au.